Mr. Chairman. So just following on that same chart, the Medicaid caseload, it seems to be just trending in a stagnant line. It hasn't really shifted either way. Am I reading this correctly? I mean,
Yes, since about 2014, once the ACA went into effect, we've been relatively stable in terms of our caseload.
and you mentioned that a majority of these Medicaid cases are children.
That's correct.
And yet, if I understand correctly, Texas ranks 50th out of 50th in terms of uninsured children. Is that correct?
I'm not entirely sure about that percentage, no. It may very well be correct, I just don't know.
Well, it's my understanding we have the highest rate of uninsured children in the state, in the country. And so we have a flat caseload here on Medicaid, which majority of those cases are children, and yet we're 50th out of 50th in terms of uninsured children. So where is the disconnect here? Why are we not insuring more children?
I think that would go to basically the eligibility that we have for the Medicaid program and where children are in terms of under either under or above that line of eligibility.
You're saying that they're not eligible?
That would be correct.
Okay, I think that there's a disconnect here. That, just looking at these initial charts that you provide in this information as to why there's such a high number of uninsured children, and yet our Medicaid caseload is just stagnant, and yet we could be insuring more children. We could be providing more insurance for our kids, and yet we're not. Obviously, we have the capacity to handle it if we're just stagnating on our caseloads. And so, did you want to add something?
Well, Stephanie Muse, State Medicaid Director. I was just going to add that from an eligibility perspective and the processing of eligibility, we haven't seen any changes in the way that we do that. So we are definitely seeing that fewer people are coming through the doors that are Medicaid eligible. Whether or not I don't think what we can't speak to is how much of the uninsured rate is due to individuals who are Medicaid eligible but not receiving it. We do have populations in Texas that don't qualify for the Medicaid program that make up part of that uninsured number, such as some of your non-citizens.
Okay, well, I know that my colleagues and we've been talking about this. We don't want to be last in terms of, the number of children that don't have insurance in the state. That's ridiculous. And so I know we're going to be working hard to fix this issue. I intend to discuss it further, especially when I'm seeing that our Medicaid caseload is not moving, and we have the capacity to insure our children, and I believe we should get that done this session.